Teeth whitening, what works and what doesn't work. It's important to know what product to use to get the best result, least sensitivity, and in a safest way. Teeth whitening, there are so many brands out there, but basically there is only two techniques you can use. You can only whiten enamel in two ways. Either the material you're using is chemically dissolving the color and stains on the surface of the teeth, or it's physically rubbing away a layer of enamel, leaving another layer underneath, which of course will be white. But how much enamel do you think we have? We have maximum 2 millimeters of enamel on the surfaces of our teeth. As we age, we are going to lose enamel anyways. We are going to have thinner enamel. Not to mention, if you use something that's gritty, like charcoal toothpaste, you're rubbing away a layer of enamel and you're leaving behind another layer that, yes, is whiter, but as the enamel gets thinner and thinner, your teeth are going to look really, really yellow, because that's going to show the second layer of the teeth. Second layer of everybody's teeth is called dentine. Dentine in nature is very yellow, and enamel on top in nature is very translucent. So enamel is going to show the color of dentine inside. Now imagine you are thinning your enamel on purpose, thinking you're whitening your teeth. The result will be yellower teeth because your dentine is showing. The other option is to chemically remove the stains from the surface of the teeth. Bleach the stains basically. The problem most of us have is that our patients think that we can get any color we want, as white as possible, and we are not doing it somehow. That is not the case. With bleaching your teeth, we are only removing the stain layer from the surface of the tooth. If the tooth that shows underneath, if the enamel that shows underneath is not what you want, there are other options like composite bonding, porcelain veneers, but they are semi-permanent options. They do cause some sort of damage to the tooth, and they are not as minimally invasive as bleaching your teeth. By bleaching your teeth, we are usually using a hydrogen peroxide or some sort of a peroxide treatment, whether it's hydrogen or carbamide peroxide. It's going to dissolve the color, wash it away, and leave your own enamel behind. The first thing you want to do is you want to talk to a dental professional. You don't want to go and buy something off supermarkets and using on your teeth where it's not working, it's not suitable for you, or it's causing more damage. What are we going to check? A dental professional is going to check that your gums are healthy and you are okay to have teeth whitening done. There are people who are not suitable to get teeth whitening done. There are other options for them. So that's what you want to check first. Secondly, you want to make sure that your dental cleaning professional hygiene appointment has been within the last 3 to 6 months. If there are buildup and plaques on the surface of your teeth, teeth whitening is not going to do anything. It can't reach the enamel anyways. Next, you want to pick the option that's best for you. There are only two options when you're doing teeth whitening. It's either in chair, in the office, by a dental professional, or it's at home. Or you can do a combination of both. The in-office teeth whitening works this way. We are going to retract cheeks, tongue, and all the soft tissue. Make sure that the gel does not come in contact with it, because the gel works on hard surface but burns the soft surfaces of your mouth. So we don't want to touch the gums, for example. Although it's not dangerous, but you want to avoid that because it doesn't feel nice. Secondly, we are going to put the gel on the surface of your teeth and keep changing the gel every 5 to 10 to 15 minutes to give you a new round of gel. That way, 3 or 4 rounds after, you'll see whiter result right away. So the difference is within 1 or 2 hours, you're going to see all the stains gone and your teeth whiter. Now, the downside of that is that it does cause a bit of sensitivity. It really depends on how healthy your teeth are, how sensitive your teeth are. If there are any cracks, we cannot see. Because if that's the case, you're going to feel sensitive. Although this kind of sensitivity never lasts. You're going to experience it for a few minutes to a few hours to maximum few days. The second option is to do it at home. So we give you a weaker gel that is okay and safe if it runs around and touches your gum. That's when you can use it every night for a few nights in a row, and then you can see the same result that you would have had in chair. The best option, in my opinion, is first talk to a dental professional. See what's best for you. But if you're going to do an office teeth whitening where you can get the result right away, remember that as soon as you eat something, and it doesn't have to be coffee or wine, as soon as you eat anything, you're going to have stains back on your teeth. Slowly, and gradually, you'll see the result gone. So you can either do routine teeth whitening according to your dental professional, ask them how often you can do it, or you can do an office teeth whitening, get the home whitening, and continue at home whenever you feel like the result is going away. Thank you so much for watching. I'll see you in my next video.